Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be covering a pharmacology for the nervous system. This is going to be part one of a multi-part series. There are lots of drugs that we need to cover in the nervous system. Now, if you are new to my channel, let me be clear. I do not believe in fluff. If I'm talking about a drug, that means it's important to know. So when we go over the different slides, don't only pay attention to the correct answer, pay attention to the other drug classes or the other drugs that are your options because those are important drugs for you to know as well. If it's coming out of my mouth, you're most likely going to see it on a test somewhere. So make sure you watch this video again if you have to in order to take notes. Um, what else did I want to say to you? Oh, don't forget, guys, check out my website, nexusnursinginstitute.com. So many great resources available for you. Very, very soon. Can you guys see? Oh, you guys can't see this, so I'm not even going to bring it up. Anyway, very, very soon, my NCLEX next generation NCLEX cheat sheet is coming out very, very soon. So watch out for that. You guys will be able to order it on Amazon. You can also order on my website, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere at Nexus Nursing. Now, let me be clear. This textbook that's not textbook, but this book that's coming out, it's not giving you the answers to NCLEX. I do not write NCLEX. I have not seen the test. They won't let me. Now, let me tell you what this book is. I've had hundreds, probably thousands of students that I've tutored, okay? They've gone and taken their boards and they've come back and they'll say, Professor D, oh, I remember seeing this or I remember seeing that. Not their answer, because I don't know if they chose the correct answer, just topics that they remember seeing. And I started noticing that there are certain topics that are coming up over and over and over again, no matter what state my students testing in. Doesn't matter if they're in California, if they're in Texas, New York, Florida, they're seeing the same content. And so what I did was these content that the students are seeing over and over and over again, I'm presenting it to you, just letting you know, giving you a heads up. I'm not telling you what to study, but I'm letting you know if you study anything, make sure you study this first. So that's what that book is. It's coming soon again. Check out my website, nexusnursinginstitute.com. Okay, I'm not going to take up any more of your time, guys. Without any further ado, let's get started. Pharmacology for the nervous system, part one. Okay. What drug class makes GABA more effective? Is it benzodiazepines, hypnotic agents, sedatives, or is it anxiolytics? What drug class makes GABA more effective? What do you guys think? If you guys were not able to get on the Kahoot, you guys can still participate on the live. Just type in your answer on the live. What do you think the answer is? Very good. Benzodiazepines. So what do you need to know about benzodiazepines? Well, obviously you need to know that one of the ways that the most important way that it's effective is that it makes GABA more effective. Now, a couple things you need to know about benzodiazepines. You need to know the indications, okay? So benzodiazepines, they're given to treat anxiety, but also they're given to treat alcohol withdrawal. I can't, if I had a penny for every single time that has been reported back to me that a student has seen that on NCLEX, I'd be a rich woman by now. Okay, so that's very important for you to know. So it decreases anxiety. It's good for treating alcohol withdrawal. Also, patients who have anxiety for surgery. So right before a patient has surgery to help kind of calm them down, it's also used for that, kind of used as an anxiolytic. Now, a hypnotic agent that suppresses the CNS. It can cause CNS depression, causes you to go to sleep. Same thing with sedatives and anxiolytics. I feel like there's one more thing you have to know about benzos. Yes, let me tell you something. You see benzodiazepine? Let me tell you how NCLEX will get you. This type of question will be a case study where they give you the patient that, they've been in the hospital for 2 days, they're about to get surgery, and you're going through the chart. And in the chart, in that patient's history, you will see that that patient is currently on an opioid. Are you going to go ahead and administer? Because the way they're going to do that case study, decline, wait. The way they're going to do the case study, it's going to make you feel like you're rushed for time. You got to get that patient in, right? But you saw that that patient is on an opioid or they just got an opioid. Are you going to go ahead and administer that benzodiazepine? Absolutely not. Let me tell you something. Benzodiazepines have a black box warning against that. You go ahead and administer that opioid and something happens to the patient, like they die, you're standing before the board of nursing trying to defend your license and you're not going to be able to. You're going to lose your license because you should have known better. Okay. So that's another very big thing that you need to know about benzos. Benzos and opioids, big no no. Okay. True or false? Can benzodiazepines be stopped abruptly? Is this true or is this false? Benzodiazepines can be stopped abruptly. Is this true or is this false? Tell me why. Everyone that's on the live, tell me why. I'm seeing your answers. Tell me why. I'm not seeing the answer yet. Very good. False. False. Why? The reason benzos can't be stopped abruptly, it can cause the patient to have withdrawal symptom. Now, let me take this a step further. Let me just say this to you guys. Any drugs that alters a patient's mental status can't be stopped abruptly. And the reason for that, 98% of the time, it could cause them to have seizures. In this particular instance, the reason we're not doing it is because it can cause a withdrawal symptom. You need to know that phrase. You need to be able to connect it with benzodiazepines and stopping abruptly. It's called withdrawal symptoms, where the patient can have nausea, vomiting, nightmares, vertigo, headache. Okay, they can have really severe symptoms. But generally speaking, if it's a CNS drug, you're not going to stop abruptly because you can cause a patient to have some seizures, just generally speaking. True or false? Intraarterial is the preferred route for benzodiazepine administration. Is this true or is this false? So the intraarterial route, that is the preferred route for benzodiazepine administration. Is this true or is this false? Now notice out of 14 slides, I've already dedicated 3 of them to benzodiazepines. What does that tell you? Okay. All right. Play with it if you want to, guys. Make sure you know your benzos. Don't say I didn't warn you. That's right. It's on NCLEX. A whole lot. Uh-huh. You got it. Okay, very good. 88, most of you guys said false. You cannot. The reason that you cannot, it can cause arterial spasms. It can cause that patient to lose that limb. You can cause the patient to lose that limb that they had the arterial spasms in. So, under no circumstances are you ever going to administer this drug intraarterially. And let me take it a step further. If you get a question and it tells you that this is what has been ordered, you're not going to do it like a blind computer. No, you're going to withhold that drug and place a phone call to the healthcare provider. And if they say they want you to do it, you tell them to come down and do it themselves because you're not going to lose your license because you know better. Okay? All right, let's keep going. All right, type in your answer. If a patient receives parental benzodiazepine, they must remain on bed rest for at least how many hours? Type in your answer. Now, remember, guys, I'm killing you with benzos for a reason. You better know everything there is to know about benzos, right? Remember, the indication we're going to give it, guys, for anxiety. We're going to give it for alcohol withdrawal. We're going to give it for agitation, right? We're giving this thing parentally. How long would they have to remain on bed rest before it's safe for them to get up out of that bed? Okay, Alex, I see you. Good job. Don't cheat off of Alex. 6, 8, 48 hours, 12. It's 3. 3 hours, guys. 3 hours that patient needs to remain in bed. No operating heavy machinery. No driving. We want to keep that patient safe. Okay, 3 hours. So that's very important. If you get a question about benzos and times, you better look at the time that drug was given to know when that patient will be allowed out of bed. And the first time that they're allowed out of bed, are you just going to let them get up out of bed? No, you're going to assist them. You're going to get them up slowly. They're going to dangle their legs. You're going to stand them up slowly. We don't want them to have orthostatic hypotension. You're going to help them ambulate to the restroom and back to the bed because you don't want any falls on your hands. All right, select all that apply. What does it say? Let me move this. What are comfort measures to help the patient tolerate the drug effect of benzodiazepines? Here are your options. Void before dosing, void after dosing, give food with the drug, give food without the drug, lower lighting and stimuli, encourage visitors to avoid depression. So, what are the comfort measures that you as a nurse would promote to help the patient tolerate the drug effects of benzodiazepines? All right, very good. So, you're going to help the patient void before dosing. Why? Well, didn't I just tell you they have to stay in bed for 3 hours after you give this drug? So, would it not make sense to make sure they empty their bladder before administration of that drug since they can't get up for 3 hours? So, yes, you're going to have them empty their bladder before drug administration. You're going to give the drug with food. Why? You want to avoid GI upset and lower lighting and stimuli. That makes sense. Remember, I think it was the very first slide when I was explaining to you chemically the action of the drug. What did I say? I said the CNS depressant, right? So if it slows everything down, it brings everything down. Why in the world would you want to have bright lights, which increase stimulation, not decrease stimulation? Why would you want to have the TV on? Why would you want to have the radio on? Why would you want to have frequent visitors? All of those things increase stimulation. Let me tell you a beautiful, famous scenario NCLEX likes to give you. Why would you have them right next to the nurse's station? As students, I know what you're thinking. Okay, this patient's in a real bad shape. They're about to go to surgery, so I got to keep an eye on them. So they should be right next to the nurse's station. You have to remember, if the patient has anything going on with them, that they're either on a CNS depressant or they have a condition where they need low stimuli, such as what? Seizure patient, epileptic patients, you're not going to have them next to the nurse's station where you got family complaining, the phones are going off. How do you guys say that in English? The phones are going off the ring, off the hook. You know what I mean? The phones are ringing. Um, Nurses are getting reports from other nurses. They're giving report. No, you want them in a quiet environment, so you'd have them at the end of the hall. Okay? You're not going to put them in the room with someone if you can avoid doing that. All right, true or false? Barbiturates. Okay, we're talking about another drug class now. Barbiturates are the sedative hypnotic drug of choice. Is this true or is this false? We're now talking about barbiturates. Oh, thank you. Ringing off the hook. Ringing off the hook. What do you guys think about barbiturates? Barbiturates are the sedative hypnotic drug of choice. Is this true or is this false? Tell me why. Tell me why. Very good, Bree Bree. False. It's kind of close, but it's false. Barbiturates used to be the drug of choice. Now we have better drug classes on the market. And here's why it's no longer the drug of choice. Barbiturates are so not only the amount of sedation that they cause, they're very addictive. They are very, very, very addictive. They're addictive to the point. Let me tell you something. You will lose your license if you give a barbiturate to a patient that has a history of addiction. And it doesn't have to be that same type of addiction. It doesn't have to be addiction to sedatives or hypnotic agents or anxiolytics. It could be addiction to food. It could be addiction to opioids. If they already have a history of addiction, you cannot give a barbiturate to a patient. You'll lose your license. Okay? All right. True or false? Antihistamines are commonly used pre-op and post-op. Is this true or is this false? Antihistamines are commonly used preoperatively and postoperatively. Is this true or is this false? You're about to find out soon, Ellie. True. Ellie said she can't understand why it could be true. I'm going to explain to you why this is true. Um, Antihistamines have a sedating effect. And so it's commonly used because instead of having to give patients, narcotics that also have a sedating effect, but there are also adverse effects that we prefer to avoid, we can give them antihistamines. Okay, so antihistamines are commonly used pre-op and post-op. They have sedating effect. It helps us avoid giving narcotics. Something you have to keep in mind about guys, please stop asking. I don't ever co-host my lives. Stop interrupting the live, please. Something very important that you have to know about antihistamines, and I'm going to say this to you, you'll never forget it. When it comes to antihistamines, those who've been following me for a long time, you already know what I'm about to say, right? Can't see, can't spit, can't pee, can't see, blurred vision. Can't spit, dry mouth, xerostomia. Can't pee, urinary obstruction. Can't constipation. Can't see, can't spit, can't pee, can't. Those are the four adverse effects you better know about antihistamines. Don't say I didn't warn you. All right, let's keep going. All right, type in your answer. I'm not even going to try to pronounce that drug, but you see it. It's given at how many micrograms per kilogram? Over 10 minutes, followed by a controlled infusion pump for up to 24 hours. I gave you most of the answer that you need to know for NCLEX. You only have to give me back a little bit. You better know this. This drug that I'm not going to try to pronounce, it's given for over 10 minutes. And after it's given, the rest has to be given on an infusion pump for a whole 24 hours. But during that 10 minutes that this drug is given, you are giving it at how many micrograms per kilogram? That is my question. How many micrograms per kilogram? Why only 9 people answered? Wow. Wait a minute. Let me review these answers. Guys, the correct answer is one. And on NCLEX, one is too easy. So that's not what they're going to ask you. They're either, if you get a question like this, they're going to either ask you for what is the duration before that drug's administered on the infusion pump, which is 10 minutes, or after it's been given 1 milligram per kilogram over 10 minutes, how long is the rest going to be given with infusion pump, which is 24 hours, Or it'll ask you after it's been given that 1 milligram per kilogram over 10 minutes, what device, if any, will be used, and you need to know that infusion pump because a precise amount has to be given. 10 to 5, 100. Oh my gosh, you guys killed your patients so many times. It's 1 milligram per kilogram over 10 minutes. Okay. Followed by infusion pump for 24 hours. Okay. Which anxiolytic drug is preferred when the patient must be alert because it does not cause CNS depression or muscle relaxation? So we're not talking about a sedative now. We're talking about anxiolytic. We're talking about drug to decrease the patient's anxiety. Which anxiolytic drug is preferred when the patient has to be alert, so they have to be able to answer questions? Which drug is preferred because it does not depress the CNS system, it does not cause muscle relaxation? Is it buspirone, alprazolam, chlorodiazepam? I can't speak. Chlorodiazepoxide or secobarbital? Which one? You guys know I can't pronounce. Very good. Most of you guys got it right. Buspirone. Very, very good. If we need that patient to be alert and able to answer questions, we can't have them groggy or sedated. That is a drug of choice. Okay. Alprazolam, that's what, a benzo. That chloral drug that I can't even pronounce, that's also a benzo. And your seco barbital, that's what? A barbiturate. Guys, you need to know which drugs fall under which drug class. And I say this all the time, the easiest way to learn your drugs is by drug class because the drug class will have something in common. So the adverse effects will be the same. The nursing interventions will be the same. The drug interactions will be the same. So learn your drugs by drug class. It's going to make your life a lot easier than trying to just learn the drug individually. Okay, which drug class is the number one first line preferred antidepressant? Number one. Is it your TCAs? Is it your MAOIs? Is it your SSRIs? Or is it your SNIs? Which ones are the number one first line antidepressant? The patient's been diagnosed with major depression. This is the first line drug class expected to be ordered for this patient. Okay, most of you on my live, you got it right. Now tell me why. Tell me why. Oh, everyone's quiet now. Come on. Very good. Yes. So the correct answer is your SSRIs. That is the number one class of drugs we expect to be given for depression. And the reason is it has the least amount of side effects with the highest efficacy. Your TCAs next, your MAOIs last. Everything interacts with MAOIs. If you're on an MAOI, you can hardly have anything. Everything interacts with MAOIs. And so what happens is patients who have been on antidepressants for a very long time, after X amount of years, the SSRIs just don't work anymore. And so there's no choice. We have to move on to the next drug class and the next drug class. And last is the MAOIs because they've got food drug interactions, they've got drug interactions, they've got adverse interactions. It's a whole mess. Okay? You got it. Okay, which antidepressant agent is also effective in helping patients to stop smoking? This is another one. If I had a penny every single time this question was asked on NCLEX, I'd be a rich woman. They will ask the same question in 150 million ways. They will give you a big, long case study just to get to the point of this question. Make sure you know it. Here are your options: amitriptyline, citalopram, duloxetine, or bupropion. Very good. Very good. Bupropion. So in low doses, it actually helps you to stop smoking. So a patient that has depression, but they're also a smoker, this is a great choice. This is something you'd expect to be ordered for this patient. Now, amitriptyline, that's a TCA. You need to know that drug. Your citalopram, that's an SSRI. You know we love our SSRIs. And duloxetine, that's an SNI. Okay? True or false? The TCAs are anticholinergic. Is this true or is this false? I'm very proud of you guys on the live. You guys are doing really well. You better not be Googling the answers. You guys are doing great. True or false? TCAs are anticholinergic. True, yes. Try cyclic antidepressant agents. They are anticholinergics. Can't see, can't spit, can't pee, can't. Mm-hmm. Okay. Can't see, blurred vision, can't spit, dry mouth, or xerostomia. If you see that word xerostomia, it means dry mouth, okay? Dried secretions. Can't see, can't spit, can't pee, that's urinary retention. And can't, you know what? That is constipation. I don't give you guys enough time to cheat. Okay, good. I like it. All right, select all that apply. Which foods are contraindicated with MAOI? Select all that apply. Here are your options: cottage cheese, red wine, yogurt, salami, sour cream, pickled cheese. Did I mean to put pickle? I did not mean to put pickled cheese. I think I meant to put pickles. So the last one, it says pickled cheese, but I meant pickles. Pickled cheese. Sorry. Cottage cheese, red wine, yogurt, salami, sour cream, pickles, not pickled cheese. This is interesting. All right, so let's talk about this. Okay, if a patient's on an MAOI, they cannot have anything that's high in tyramine, right? So foods that are high in tyramine are anything that's fermented, anything that is pickled. And you see that first one, cottage cheese, I put that on there on purpose because NCLEX loves putting that as an option and it gets so many students. Cottage cheese is uh not fermented, what's the word I'm looking for? Also like yeast. Um Aged, yes. Cottage cheese is not aged. Things that are aged are high in tyramine, but cottage cheese is not aged. So that's why cottage cheese is not an chosen as an option. Cottage cheese, yogurt, that's not aged, so that means the patient can have that. Sour cream, that's not aged. The patient can have that. But red wine, salami, pickles, cheddar cheese, blue cheese. Now, those type of cheeses are aged. So I'm telling you now, if you're taking psych, you need to know what I'm talking about. And if you're studying for boards, you better go back and look at the list for foods that's safe for MAOIs versus foods that are not safe because the cheeses it gets very tricky. And as much as I say NCLEX is fair 90% of the time, that's the 10% I feel like they're not fair because they do give you different cheese options. And it's so confusing. That's just one of the things you just have to know. There's no way around it. You need to know which ones are aged and which ones are not. Anything that's pickled, anything that's fermented, anything that's aged, the patient can't have. All right, last question. True or false? All antidepressant agents have the risk of suicidality, especially in children, adolescents, and young adults. Is this true or is this false? Will you be posting this video on your YouTube channel? Yes, I will be posting this. It'll be up about an hour after this live. So the question is, all antidepressant agents have the risk of suicidality, especially in children, adolescents, and young adults. Is this true or is this false? True. 99% of the time, whenever you see all-inclusive words such as all, always, none, never, don't ever choose that as the answer. And 99% of the time, whenever you see those all-inclusive words, the answer is wrong. This is an exception. Yeah, all antidepressant agents carry that risk, especially in children, adolescents, and young adults. Matter of fact, the younger that they are, the higher the risk is. And that's ironic because it's an antidepressant. It's supposed to have the opposite effect. So here's what happens. The longer that the patient is on the antidepressant, the lower the risk. But those first couple weeks, the risk is the highest, the younger that the patient is. Okay? Very important for you to know. All right. And that is it. Again, guys, don't forget this is going to be a multi-part series. So watch out for part 2, 3, even 4, because lots of neural drugs that you guys need to know. Okay. Let's see how you guys did.